Let's now turn our attention to the latest news around COVID-19, where the World Health Organization has raised concern that the Omicron and Delta variants combined will produce a tsunami of cases. According to the WHO's figures, the number of COVID-19 cases recorded worldwide increased by 11% last week. That's compared with the previous week. For more on this, I'm joined by Dr. Mvuyisi Mzukwa, who is Vice Chair at the SA Medical Association. A very good morning to you, Doctor. Thank you so much for your time. The data so far is showing that cases have surged across the world, and the WHO has sent out this warning of a tsunami of cases. What does this mean for South Africa?
Good morning to you, Mpo, and your viewers. Thanks for having me in your program. I think we have noted the statement by the Chief of the World Health Organization. You remember that this Omicron was discovered here in the Southern Africa, and we informed the world. But noting the trends in our own country, we are seeing no pressure in the hospital facilities, though we still have high numbers, but we have seen also a drop in those numbers in the last few days. So I do think that it's a picture that they need to be considering. But having said that, I mean, if you look at our context and their context, they are two different. First of all, there's so much of population in terms of millions and millions of them in those countries. In the US, for example. But also, if you look at Europe, it's an aging population. And you would expect that their context might not be the same with us in terms of who is getting hospitalized. Because once you hit that age, more than 60 years of age, you tend to have underlying medical conditions, and those, they make you vulnerable to severe form of COVID. So I think that's the issue. The other thing is that in our country, we have noted that even though we have not that much of the uptake of vaccines, but compared to those other countries, especially the rich countries, they had those vaccines earlier, and now their immunity has waned, and they need boosters. So it is it's something that they need to speed up in terms of getting boosters, which is what also very controversial, because there are countries who have no vaccines. But in our context, South Africa, what do you do with the vaccines when the uptake is low? You go for boosters.
And as we, of course, take a look at the latest information coming out, surely this now is forcing governments across the world to walk on a tightrope when it comes to some rules and regulations. I mean, like here in South Africa, for instance, we saw the withdrawal of the new COVID-19 guidelines, and government saying that now is perhaps not the time, and the decision around contact tracing may again be visited in the foreseeable future.
Well, Mpo, to be honest with you, this was a very clumsy decision by the National Department of Health. It was disappointing, showed lack of leadership, because, I mean, you would understand that this has a negative impact on the local clinics and the small hospitals, district hospitals, who in most cases have a very few staff capacity or staff numbers. So you wouldn't want to use measures that are useless. Quarantine, we know by now that it is useless. And that contact tracing, if you have got high numbers of people who are contaminated with COVID. I mean, for example, at some point we had about 26,000. I mean, how do you on earth do contact tracing for 26,000 people? So it's ridiculous that instead of following science, they are now bowing to political pressure or whatever pressure that comes from them.
And what do you think, perhaps, are some of the tighter contingency measures that need to take place with these, this warning coming out of a tsunami of COVID-19 cases? I mean, that on its own, the word tsunami sounds really frightening.
Well, he was talking in the context, you remember, in the context of the combination of Omicron and Delta. which are highly contagious viruses. In South Africa, the only thing that we need to do is encourage citizens to go for vaccination. We need to ramp up our vaccination program, encourage citizens to take up those, and making sure that we target those that are at high risk, and making sure that we don't leave anyone behind. Even the issue of foreign nationals who are not documented, it has to be taken into consideration in South Africa instead of excluding them. So it is very important for us to understand that other than the vaccinations as well, there's non-pharmaceutical interventions. Like, for example, now the problem is that you have everybody organizing a function, everybody organizing a wedding, and everybody organizing whatever the issue is. Recently, there was one of my patients who contacted COVID-19. They had organized a function, with more than with about 3 tents, big tents. I mean, how do you explain that people are still organizing such big events in the midst of this virus?
And as the pandemic drags on, Doctor, we know that the WHO has also warned that a new COVID-19 variants could now emerge that are fully resistant to vaccines, because, I mean, this tsunami speaks volumes in terms of the pace of the COVID-19 and how it's spreading.
Yeah, we've got to work together. I think people need to realize that we've got one world. We don't have the US and the Africa and all those. We've got one global village. And if we are to administer anything or even roll out any vaccine program, it has to be a world program, that covers everyone equitably. If we don't do that, we are still going to come out with resistant variants, that are going to affect the very people who are holding on vaccines. So it's not only a threat to the poor countries, it is a threat to the rich countries as well. So we do need to encourage and follow that advice from the World Health Organization chief. It's very important. We know that people have closed us out. When we had Omicron, discovered Omicron, they said, no, we're shutting our borders, don't come in. Look what is happening now. It's in there.
And how do you imagine this warning to affect movement across the countries? I mean, some bans have been lifted, travel bans lifted, for instance, the US just recently. Do you imagine a situation where some of those decisions may be reversed?
Very much possible that, people will come to their senses, especially when they realize that this Omicron variant it's not that bad in terms of causing hospitalizations. There will be no need to impose further restrictions. I mean, we've made an example with our country, South Africa. We've got cases dropping without imposing any further restrictions. So I think it is going to be a lesson to all of us. So there's no need to ban countries to visit each other or even to continue their economic activities because we're scared of this Omicron thing. It's just that we need to take the current provisions and protocols on COVID-19 and move forward and make sure that we're vaccinating everybody. That call that says by next year we should have at least 70% of populations mid-year vaccinated. We should follow that, but we must make sure that those resources are available to the poor countries.
And very lastly, before we let you go, we have heard a lot of comments across social media, many people calling for the time frames to be readjusted when it comes to New Year's celebrations. People saying they don't want to be restricted, they want more freedom in terms of movement and time. Do you think that this is a decision that should be reversed given the current situation?
I mean, look, Mpo, no matter how you look at it, there is no way that a government is going to implement that curfew thing on the 31st. It's impossible. It's some of the things that should have been done away a long time ago. This curfew thing is not working. So I do think that there are many things, including the one that was reversed recently, that we just have to do away with them I believe that we're just wasting resources and wasting time. We're just, overburdening police with unnecessary policing.
Very well. Thank you so much for your time. Let's leave it there for now.